or a provider, and at this point you don't feel like the nurses love you, consider that it's your fault. Here's a general concept. If you could do something in the same amount of time it would take you to ask someone else to do it, consider. And some docs will reflexively say, like, I went to doctor school, I did not go to patient care tech school, whatever, and I get it, right? And no, I'm not gonna be like walking patients or getting a tray of food for them if I have a central line to put in, a lumbar puncture to do, and someone to intubate. We're obviously not talking about those scenarios. But if you're even in a moderate acuity scenario, you can get a PO challenge yourself. And the amount of time it would take for you to go, figure out who the nurse was, remember their name, ask them to do something, you could like go to a fridge, pick something up with your hands, and give it to them. If you need to see if Mima is able to walk after a fall, consider standing them up as you talk to their family. One thing that I was told to do in residency that got me so many brownie points early is printing out my own discharge paperwork, handing it to the patient, because I'm going to be discussing with them, here's who you follow up with, here's the prescriptions, here's how often you take it, here's who I think you should follow up with, here's what we look for, here are your return precautions. That's at least a couple-minute conversation you should be having with every patient anyway. What's the barrier to then saying, here's your discharge paperwork, I took your IV out while we had this conversation? It's not that hard. And different hospitals will have different methods of who prints out discharge paperwork, who does these things, but if you're able to do it without burdening one of your colleagues to do the same thing, that makes everyone have a better day. I feel like most ER, critical care, acute care docs have had that scenario where like someone is in a room and discharged and you have someone in a hallway that you want in a room. You can do that yourself. Or you see that patient who you know 100% you need to do an ultrasound IV. You don't have to. There is no law that says you need to wait for a nurse to fail twice and then the supervising nurse to fail twice and then the patient stuck 4 times. Do it yourself. I try to, in a lot of facets of my life, presume the most generous interpretation of someone else's situation, right? I wouldn't call someone lazy if they asked me to do an ultrasound IV. I don't assume that they're not trying and they're trying to like get me to do more work and for them to have an easier day. I assume most healthcare workers, whether it's right or not, are trying their best. And if you're a resident and you don't have a fantastic relationship with your nursing colleagues or other staff, consider making it better yourself. Okay. Have a good day.